Step therapy, or fail-first protocols, is a practice used by insurers that requires patients to try lower-cost medications before permitting them more expensive treatments. This is true even when the doctor wants to prescribe them. So, for example, a patient may be prescribed Orencia, an expensive biologic, to treat her rheumatoid arthritis, but an insurer with step therapy may not cover Orencia unless the patient tries methotrexate, which is typically much cheaper. That patient may not receive Orencia unless she does not respond to methotrexate. That's true even if her physician believes that Orencia is the best course of treatment for her. And even if she eventually receives Orencia, if that patient switches insurers, she may have to try and fail methotrexate again. Step therapy is applied to drugs treating a wide range of conditions, including rheumatoid arthritis, other autoimmune diseases, psoriatic arthritis, cancer, mental health, and many others. Our latest data shows that more and more insurers are offering plans that utilize step therapy. And unfortunately, step therapy can have a very negative impact on patients, including delayed access to the most effective treatment, which could lead to a faster disease progression and potentially increased healthcare costs for the patient. To rectify this, the Foundation advocates for adequate patient protections to address some of these common issues. So specifically, we push for legislation that ensures step therapy protocols are based on clinical guidelines and not solely on the cost of the prescription to the health plan. Additionally, our model legislation provides for a transparent exception request and appeals process for both patients and providers, as well as establishes circumstances that the prescriber may be able to override step therapy when medically appropriate. So this is situations where the insurer may require medication which is contraindicated to the patient, or that the patient has already tried and failed the drug in the past. Lastly, we ask in our bills that all requests and appeals be determined by the insurer within 72 hours for non-emergency and 24 hours for emergency cases. As of this recording, almost 15 states have adopted these limitations on step therapy protocols, with legislation pending and many more. If you believe that this practice may have happened to you, or if you have an opinion on this policy, please share your story through our Action Center. Our newly launched Step Therapy Story Bank is available at the link below.